Doc, I've been diagnosed with carpal tunnel surgery. I've been going to physical therapy and it's not helping. They're suggesting surgery. Is this something you treat regularly? And if so, how successful? Extremely successful. Extremely successful. And I do it all the time. It's that simple. Right? Now why? What's going on here? So you can go through all the sciencey aspect of it, what the carpal tunnel is and so on. And they like to surgically, they cut the little sheath that goes across the inside of the wrist, right? They'll cut that little tendon and alleviate the pressure. But you weren't born with it, right? You didn't start out of the gate with carpal tunnel. You acquired it. So that means that there's an inflammation going on somewhere that swelled up that area, pinches off the nerve and affects the fingers. Now the question is, where's that at? Where's the inflammation at? Is it only in the tendons going through the wrist? Not really, right? There's other places. And if they cut that tendon, that sheath, that's great, but they didn't get rid of the inflammation, did they? And so all of a sudden, what tends to happen with carpal tunnel surgeries? People have to have something done again later on. Now they're shaving the tendons down and making them more narrow and skinnier and all that. Looks good. Right? Isn't it crazy?
The bones, that just doesn't sound...
Nothing sounds good about
like
shaving things inside
idea.
there. You know, you're sitting there with a whittling and a pocket knife, right? So the idea behind this then, with carpal tunnel, just restore normal. The nerves from the neck and the brain, right, the spinal cord, have to go down the arm. They change names a few times, but it's the same stuff, right? All they do is change names. So as they're going down the arm like that, you got to think, okay, are there any spots where things can mechanically be obstructed? Well, look at the flexible part. Start with the neck, number one, because that's where it all starts. Then go to the shoulder joint. Go to the elbow joint. Go to the wrists and fingers. That's the flexible joint. So look for things to be pinched or grabbed. Just put this image in your head like a garden hose, right? If you fold the hose, you get less water. If you fold it in 2 or 3 or 4 spots, you're getting nothing. And that's really what carpal tunnel is. So you go through, then you say, all right, I just got to make sure everything's open. Now, once everything's open and everything's moving and functioning, then all you have to do is restore normal. Balance the muscles, balance the nervous system, adjust the joints. Carpal tunnel goes away, guys. It's cake. We'll be back in just a moment.